Here are 6 signs your cat may have an ear infection and what you need to do to help. My name is Dr. Sarah Wooten, and I am a small animal veterinarian with over 20 years experience in veterinary medicine. Ear infections are extremely painful for cats, and they can actually lead to permanent hearing loss or brain damage if the infection is bad enough. It can also lead to scarring of the ear, and in general, they're just really painful. So it's important to know what the signs are so that you can get the ear infection treated as soon as possible and minimize the risk of long-term side effects. I find it helpful to start by talking about what a normal ear looks like on a cat. So if you have a cat, just take a look at their ear now. A normal ear should be up. Most cats, almost all cats, except for a couple of fold cats, have vertical ears that are very easy to look at. The ear should be nice and pink inside, can be pigmented in black cats or other colors of cats, but most of the time it's pink. And it should be very smooth. You should be able to see a couple blood vessels. There should be no redness, no irritation. It should be smooth, pink, and hairless. And down inside the ear, you should be able to see all the little folds and the little curves of the ear structure itself. You shouldn't see any debris in that ear. You should not see any kind of organisms. You shouldn't see scabs. It should just look nice and clean. And a nice, clean, comfortable ear in cats is held straight up. And sometimes they cock it a little bit back and forth to hear things. But in general, their ears are up and they are pink and clear of debris or scabs. Let's talk about the 6 signs that your cat could have an ear infection. Number 1, redness. Remember I said a normal ear should just be quiet and pink without any redness on it. If you are noticing redness on the cat's ear or around the ear, it could be an infection. Redness causes inflammation in the ear. Also, the itching can cause the cat to scratch at the ear, and they may scratch at the front of their ear, around their forehead area right here. They may scratch at the back of their ear, so they may cause scratches behind the ear. They also may scratch on their neck when their ear is itchy. So any of those could be signs of an ear infection. The other thing to think about is red ears can also, especially in cats that have white hair, it can indicate skin cancer. So it's important if you notice redness in your cat's ears to get them checked out by a veterinarian. Number 2 sign, odor. A normal cat ear should not smell like anything. I know some dogs' feet smell like Fritos. Cat's ears should not smell like anything. So if you're cuddling with your cat and you notice a funky smell coming from that ear, that's a sign that there is an infection and it needs to be addressed by a veterinarian. Number 3, discharge ear wax. Normally cats have very minimal amounts of some light brown, tan, beige wax, very small amounts. You may never even see it. But if you are seeing larger amounts of debris in their ear, especially if it's brown or if it's dark brown, black, or it's white or green or yellow, yuck. That's signs that there is an infection in that ear and it needs to be treated. Number 4, we talked about this a little bit, but shaking and scratching. So cats may shake their head a little bit every once in a while, but if they're shaking their head constantly, or if they're scratching and digging at their ear, or even if they're rubbing their ear, they're less likely to do that than a dog. But if they're scratching a lot or rubbing their ear, especially in conjunction with any of these other signs, there's something irritating that ear and it could be an infection. So you need to get that cat checked out so that whatever is causing that cat to really dig at their ear is removed and that cat can get some relief. The number 5 sign that your cat could be experiencing an ear infection and pain that goes along with an ear infection is a flattened ear position. So we all know that when cats are mad, they tend to flatten their ears. I call those guys airplane kitties because they're mad and they'll hold their ears down and they will act mad. But if your cat is just sitting there and the ear is down, that is sign that there's something irritating that ear. And especially if it goes down and then they shake it like that, it's a really good sign that there's something in that ear that's causing a problem. Could be a piece of grass, could be a tick, could be an ear mite, could be an infection. Whatever it is, take them to the vet. And then the number 6 sign that your cat has an ear infection is a swollen ear. So cats can develop an oral hematoma. Oral, it refers to ear. It's the Latin for ear, oral. And what happens is the cat will shake their head so much that they break a blood vessel inside their ear, which will then fill the ear up with blood. It will look like a water balloon, and it will be very squishy like a water balloon. It will also be very red and painful. That's the sign that the cat has had enough and has shaken their head to oblivion enough to break a blood vessel to cause an oral hematoma. Oral hematomas in cats need to be drained out surgically and repaired, and then the infection taken care of. So if you see an oral hematoma, a swollen ear, that is a really good sign that there's an ear infection going on. And once again, that cat needs to be seen. So how to help this cat that has signs of an ear infection? The most important thing you can do is take them to a veterinarian right away, because these ear infections or ear irritations are painful. They can lose hearing, and it can progress to serious inner ear infections that affect the cat's balance. I've seen some of these infections actually travel all the way up into the brain and in the nervous system. And these infections are caused generally by bacteria, a fungus called Melasthesia, ear mites. Ear mites are a very common, very contagious problem in cats that can cause severe irritation and infection. And then the last thing is ticks. Actually, little tiny ticks can all crawl into an ear and then just live there. I actually saw a cat one time that presented for an ear infection. Turned out that the cat's ears were completely full of tiny ticks. It was so creepy, and we had to sedate that cat and then remove all the ticks manually. So when these cats have these ear infections, they need to have their ear cleaned out with all the debris taken out. They need to have a sample taken from their ear so we know what exactly we're dealing with. Are we dealing with mites? Are we dealing with bacteria? They have different treatments, so we need to know what they have in order to treat them. Once we've cleaned the ear and determined what the problem is, then we need to put the medication in. And in some cases, surgery is required, especially if you have an ear hematoma or any kind of long-term chronic scarring of the ear canal. And then when you go home, it's your job then to be able to clean the ear as indicated and apply the medication. Some medications for specific infections, such as ear mites, are a one-time treatment, so you don't have to put anything in the ear again, which is great. But if you do, you need to be able to catch that cat at least once or twice a day and put medication in their ear. It can be helpful to keep the cat indoors in a small area where it's easily accessible and you're not trying to find them under a bed or out in the yard or whatever, because it's really important that they get the medication to resolve the inflammation and the infection as soon as possible. Lastly, the other important thing to do is go back for your recheck. Most vets will want to recheck an ear infection in between 1 to 2 weeks after starting treatment. They will want to take a swab and make sure that whatever the infectious agent has been completely eliminated. So even if your cat is feeling great and doing better and you really don't want to go back to the vet clinic, it's still a really good thing to go, because I've seen these guys come back a couple weeks later with a relapsed infection because it wasn't totally treated. Sometimes you have to go longer. Sometimes something else pops up and we have to treat that. So it's really important, even though it's kind of a pain in the butt, to go back to the veterinary hospital and get them rechecked. That's an also very important thing for you to do. Hopefully this gives you enough information that if you ever do see the signs of ear infection in your cat, you know what to do. Thank you for watching.